Hello. Everybody's connecting. We'll just wait a few minutes here till we get everybody connected on audio, and then we'll get started.
All right. Thank you guys all for joining us today. We're excited to have you for our second South Dakota Project First Line office hours. We are going to host these on the second Wednesday of every month at the same time. The office hours, how these are going to work is we will provide a brief session of just some education from the CDC resources, so you all can kind of see what's out there and available for education for your utilization. Once we go through those resources, then we'll kind of open it up so you guys can converse back and forth if you would like, ask questions, talk about any great things that are happening with infection control within your facilities or concerns, different topics like that. So I am Jess Stanko. I am a registered respiratory therapist. I have a healthcare administration master's degree, and then recently became certified in long-term care infection control. And I have my partner on. I'll let you introduce yourself.
I'm Stephanie Popowski-Dahl, and I am a registered nurse. Been a registered nurse for almost 20 years now, so it's been a while. I've worked in a number of different settings, anywhere from med-surg peds in the hospital, clinic setting, OBGYN, long-term care. So have a good background of different settings I've worked in. So, and just recently started with the foundation.
Thanks, Stephanie.
Yeah.
So for those of you that are not familiar with Project First Line is a CDC infection prevention initiative. It was started out of COVID for a need to make sure we had infection prevention education that could be quickly shared with healthcare workers across the whole continuum of healthcare. The collaboration with South Dakota Foundation for Medical Care, which is who we work under, the South Dakota Department of Health, and the CDC has opened up the opportunities in South Dakota to really share these educational tips and free resources and have opportunities like this for the office hours. This is just a slide of some of the resources available. These are the posters, some of the posters, not even all of them, that are available on our South Dakota Project First Line website. You can retrieve these also from the CDC. What's nice is you can print these off each month, change them up in your facility if you'd like, utilize them however to really share infection control education with the staff and those that you're trying to get the knowledge out to. The CDC continually is adding new resources. There's one that came out recently on antibiotic stewardship. So just a whole lot of different topics and educational areas that might be of importance to you and relevant for the current time. The other thing that is on our website besides the posters, there's interactive resources. There's also videos. This is one of the videos. We did attempt to share it last time and it messed with our PowerPoint. So at the end, if we have time left, we will go ahead and pull this up. So those of you that haven't seen it have the opportunity to view it. We did also send it out in our a follow-up email last month. So some of you may have gotten it through the email. All right, I'm gonna go ahead and turn it over to Stephanie here.
Okay, we just want to talk about a few things that frontline healthcare workers need to know and remember about germs that live in blood. That is our topic for the month. First of all, we're going to start out, where is the risk? Viruses like HIV, your hepatitis B and C can spread in healthcare when contaminated blood is on a sharp object or item. And if that item causes a cut or a break in somebody else's skin, for an example, if there was an accidental needle stick, those germs can then spread to the person and cause a new infection. Another risk is reusing needles or syringes. This is an especially risky because germs in the blood can spread from one person to another. So we want to avoid that. Also blood in the environment, like on linens or a device, that bacteria will grow and then spread through touching or having other people touch those devices if they're not cleaned properly. Next slide. So germs that live in blood, you can see here, we've got HIV, hepatitis B, hepatitis C, and then different bacteria when they are outside of the body. So healthcare tasks involving blood, putting in an IV, giving an injection, surgery and your procedures, and then also changing soiled linen if it's been contaminated with blood. So next slide. Infection control actions to reduce the risk. Obviously, our number one would be your hand hygiene, making sure you're doing it thoroughly and effectively, doing it the way you're supposed to be doing it. The use of personal protective equipment, your gowns and your gloves and eye protection, even if you're not quite sure if you're going to be exposed to blood or contaminants, it's always a good idea to make sure that you are using PPE. Safe injections. There are so many options out there after a needle is used. Safety precautions are, that you can cover the needle. The needles can retract. So make sure that we're using those just to reduce the risk of having a unsafe stick. And then cleaning and disinfection. This is a big one. We need to make sure that we're using the correct disinfection. We're using it the way it's supposed to be used, following those directions. Also, if we're doing cleaning versus sterilization, making sure that we are doing everything we possibly can do to reduce the risk of germs being spread that way. And also your linen management, making sure that you are being careful when you are carrying, moving linen from one spot to another. And then also that those are getting disinfected properly too. Any questions? Discussion?
Yeah, please feel free to come off of mute if you do have things you'd like to share or questions on what Stephanie just shared. All of that information is just utilized from one of our posters. So that's something, like I said, could easily be shared for staff. So hung in a break room, hung in the cafeteria, just those general reminders. They're really just the basic infection control practices, but sometimes that reminder is needed. Like I've mentioned before, those posters are available to print, but if you hang a poster up and you leave it there for 3 months, nobody's probably looking at it anymore. So what's really great about our posters is there's a variety available. You could change it out once a month. So it's a new color, new visual. So maybe somebody actually will look at it, have those visual cues just to remind them to follow safe practices. This right here is our QR code to our website. It's www.southdakotaprojectfirstline.org. What we're going to do now is I'm going to stop sharing here, and I'm just going to give an opportunity to kind of talk a little bit. One of the topics from our office hour session last month was there were some questions around Candida auris and what maybe some steps were being taken to help prevent that spread. Knowing that it's close to South Dakota, I think maybe Illinois is one of the closer states that has had an outbreak. So with that spreading across the nation, what are some things we can proactively do to maybe help prepare our facilities for that? Just a couple tips. CDC is really working on some education around that right now. One of the big ones that recently I just came across in one of their presentations was to really look at your cleaning products, look at them now and see if that's something that is covered. Does your purple top wipes or whatever you're using within your facility, those EPA approved products, are they covering Candida auris? Reason being said, A lot, I shouldn't say a lot, they said some of the quat products right now do not cover that. So if you're using those quat disinfectants, maybe really look at your labels, go back and make sure that that's something that you are protecting from. First choice, first line of defense EPA products are those ones that are on the list P. So the antimicrobial products that have those direct claims against the Candida auris. If those are not available, second choice are the list K products. So that's what they're advising right now through the CDC. As we know, what's going on in our region, especially in South Dakota, is pertinent to the well-being of our facility. If one facility that you get patients transferred in and out of to you is not following proper infection prevention processes, cleaning and disinfection, that type of thing, it's very highly likely that it will be coming into your facility too. So really trying to coordinate and pay attention to what's going on regionally. I'm sure if or when South Dakota has its first case, there'll be a whole lot more coordination on this, but to really keep up with your partners that are close, facilities that are close, those type of things. The one thing about Candida auris, really, it is back to the basics for PPE. So hand hygiene, our transmission-based precautions, that environmental cleaning and disinfection that we repeatedly educate on, but ensuring that it's being done properly, that contact times are appropriate, that, like I said, the cleaning product is one that is being utilized that really targets the germ. Those are some things to really start thinking about now. Really, they're stressing early detection is going to be key to warding this off in our facilities. A lot of times there's some confusion with this diagnosis and MRSA. So just some tips and topics to kind of start thinking about for your facilities. Does anybody have any questions or comments on any of that?
This is Kim with Avera. And I think the bigger problem is being able to identify through lab testing with this. You know, how do you know if you are common testing that we are sending out is unable to detect? Avera McKinnon just got note that we will have updated BioFire panel. So we will be able to identify just at McKinnon, but that doesn't hit all of our other regional facilities. So I don't know, and maybe, you know, I don't know whoever, you know, what representation else is on the call, but just being able to know what facilities not even locally, more so regionally within the state, have the capabilities to identify.
Good question.
Anybody else on the call involved with any testing or potential testing that will be coming to your facilities? It's great to know, Kim, that Avera, at least the McKinnon, will have that option available. But for those network facilities, that means probably a send out to your facility, to the facility to get results and a wait time and all of that.
Well, and you know, we have regional facilities, you know, Aberdeen and in Yankton and Mitchell and Pierre, you know, they don't automatically send their micros or their labs to McKinnon. So it's, you know, it's very specific to just McKinnon, but you know, that's a huge challenge. And until the technology through all facilities can get up to that level to be able to identify, it's always just a mystery. And then it will be a mystery until you have a problem.
Right.
And then once you have a problem, then it's too late. So I know there's a lot of discussion about the being able to identify. And so, you know, just having your basic infection prevention practices in place to hopefully prevent, and just cross your fingers and your toes, but it will be here. Like it will come. It's inevitable. Just look at the trend over the last 7 years.
Right. It's just a matter of when, more than likely if, it will be in South Dakota. And you're very right. Those very basic infection control practices are right now probably your only defense, is making sure we've covered, like I said, the cleaning supplies. Is it being cleaned appropriately? Are we handling all of our equipment appropriately? Those type of things that you can put in place in hopes that if this does come into your facility, you're able to circumvent it from being a large spread across multiple units or areas. So anybody
And good
else have any?
reminders- Oh,
Oh.
sorry. And good reminders, just, you know, when in doubt, use PPE, use your extra precautions, just to make sure that, you know, you're protecting, you know, your staff plus other patients and residents that you might have, that you're taking care of. So.
Does anybody else have any thoughts or comments on Candida auris or any other discussions you'd like to engage in today? All right. Well, if there's nothing else that you guys would like to share on, thank you for sending in the topic. If you guys have future topics that you'd like to talk about, I certainly will do some more digging into Candida auris, and we are happy to share any information we can gather about updates on testing regionally or across the state and what that's looking like as we do our meetings with the Department of Health and other facilities, just so we can really try to take that proactive approach so we can get the education out there and so we can share with you guys what is happening so you have that knowledge in your back pocket. I think I will go ahead and pull up this video. So if you guys would like to watch that, you certainly may. If you've seen it and want to hop off the call, know that you can do that as well. Once again, thank you very much for joining us today. These are new, and we invite anybody that has an interest in infection control to join us. So if you have other facilities that you have coworkers that might have interest in joining, please go ahead and share the information, the office hours, and we will gladly have them join our calls. If there's topics and you don't want to put them in chat or come off a mute in here, but you would like to talk about them or have us do some sharing and education on it, please know that you can email us. You can reach out through our Project First Line page. We're happy to take any ideas, comments, suggestions, any of that. So I'm going to go ahead and pull up this video so you guys can watch that for those of you that have not viewed it. Can you guys see it?
Yes, we don't have any volume.
That tells me that it's not going to work again. We are having problems getting our volumes to come through on these Zoom calls, and we tested it out. We thought we had it working perfectly, but it is not. So for those of you that are on the call today, I will email this link out. It is one that's great to share with staff and employees throughout your facilities. We really recommend something like at a nurses meeting every month, share 5 minutes of infection control education. And these videos are out there and available for you to do that. So we will send the link out for that for those of you on the call. If you guys have any questions, please know that you're welcome to reach out. Otherwise, we will wrap it up for today. Thanks for joining, everyone.